Well, full disclosure, this is my first plenary talk, but it is a privilege to be in a room where the partners feel more like friends and my coworkers feel more like family. So as Doug set up, I will be talking about the Christian Health Asset Mapping Consortium, or how we refer to it fondly, CHAMC. We launched in 2022, and over the past 3.5-ish years, have really evolved in what we think of in terms of mapping, what we're able to share with you all, how we're able to even visualize our data. And so I was taken by what Anne said this morning about mapping used to mean drawn out maps, where's the latrine, and posting it somewhere in the community center, and to see where we are here is pretty neat. And so we founded CHAMC with 6 members. Here are our current members. And CCIH serves as a secretariat for CHAMC. And we really came together around the goal of increasing the understanding on the scope and scale of faith-based health services. So the problem, what gap are we trying to fill, is we know, especially in this room, all of you know, the critical work that faith-based organizations do, but they're often undercounted, and there isn't a great evidence base. We're working on that, we're building that, thanks to many of you, but that can lead to exclusion from planning, partnerships, and research, which is the big picture problem that we're trying to address. These are the 3 ways that we really try to fill that gap. One is we have a registry, a database of databases, or for the nerds in the room, a metadatabase, which is we collect summary data on faith-based health assets. And so here we have an online form. I'll show you a screenshot in a bit, but we have a website. It's called faithhealthassets.org. Please go there at some point and check out what we have online, but it's an easy place to submit summary data. So we're not asking you to send away a full Excel sheet full of geolocations, longitude, latitude. We really are focused on big picture numbers at this point to really create for people a better understanding of the big picture of Christian health assets. Then what we do is we process that a little bit, we take a look, we ask follow-up questions, and then we push that right back out to you all. We share, we have a live data dashboard where that data all comes back to not only the people in this room, we'll talk more about the stakeholders, but other people who are searching for that data, especially in disaster preparedness emergency situations. Then those 2 things combined create improved representation through better quality data that's available to you all. So who needs this information? Beyond just this room, we don't believe working in silos. We want everyone to have this information. And we've seen in different forums how it's been used. We've had a lot of interaction with WHO groups in the past few years and have been able to kind of provide a faith voice into some data registering initiatives that are kind of going alongside what we're building here as well. So we have policymakers, donors, church structures, other partners. People are really interested in this work. So this is pretty small. I don't expect you to see all the little things, but this is a screen capture of the form, the registry form we have on, again, faithhealthassets.org. It's an easy form to fill out, and really we are focused on the location of the health assets, location being just a country, nothing more specific at this time, and the type of health assets. And we use the word assets over and over again because we are not just focused on the more traditional assets, health facilities, hospitals, clinics, but the community health programs, the training institutions, the research institutions, the drug supply organizations. There's a lot of ways that Christian health services reach people, and we're trying to capture all of that because we see that as a major lack of evidence, especially for the more informal sources. And then once all that information is submitted onto the very easy registry on faithhealthassets.org, we push that out into, we have a few data visualizations. We're working on improving that also, the way that we look at the data, but so far we have a map and a couple of figures on our website. So right here you can see these are the countries that we have registered data on now. We've run into a couple of issues reconciling with DHIS2 because we're only collecting summary levels. Sometimes there's overlap or data duplication, so we're working on a methodology to figure those pieces out. But it is really cool to see at least that we're building onto this data, and we're working on a strategy and data collection for Latin America and the Caribbean right now. So if we have any folks from those regions with data in this room, I would love to talk to you before you leave the conference. So I'll just go through a few numbers. I would be remiss if I didn't actually present some numbers to you today from the regions that we have data on. We started with Sub-Saharan Africa. We originally published a data brief, and this is how our method goes. We published our data brief on Sub-Saharan Africa in 2022, heard some feedback. These numbers for Malawi look a little off. This is different. You missed this Catholic network here. And so we built onto that. 2023, we republished. The numbers here are even updated as of last month. There's a couple of these. And Achop, who is here, is working on a strategy to regularly update these. So hopefully we'll get all new numbers pretty soon. But it's pretty striking to see, even for the 17 countries and 22 networks that are on this screen, there's about 8,400 registered health assets. And so you are in luck. We just published our Asia Christian Health Assets data brief last week. So I anticipate we will follow suit with the Sub-Saharan Africa, and we'll hear maybe even from some of you all, hey, you missed a lot in my country. Let me get my data up there. And we want to hear that. This is just the initial, this is just preliminary, what we found. But the idea is to get it out there, to get the conversation started, to increase the understanding of what is here and what is in the region. So we have 11 countries covered here, but we would love to add a couple more in the next iteration. So please, if you see something off, let us know. That's the whole goal, is this is live. We're working together. We're trying to increase our understanding together. And so we have another really cool body of data that is coming, or that was just published in April of this year. So a couple months ago, we have 2 stellar volunteers that are here in this room that really worked hard to get this data together on Christian health worker training institutions globally. So you'll see globally, and that includes high income, low income, about 1,400 institutions. And those are broken down by programs, medical, nursing, oral health, occupational health. There's a few, I think 18 different types of programs are broken down there. And then our data brief, where we summarize a lot of that, focuses on the low middle income countries. That's the focus of CHAMC and a lot of what we do here. And so you'll see the top 3 countries here of number by number of institutions in those countries. And so I will make a plug, I think in the next slide even. We are having a lunch conversation today in room 207, and a lot of that will focus on this new database that we have on Christian health worker training institutions. So if you're interested in that or anything else that I shared, please do join us for lunch. Just pick up your box lunch and come to 207, and we'll have a great chat together. One thing we'll also be talking about is, as we've evolved over the first 3 years, our needs have changed. We've progressed in our thinking. We started out kind of with a formal group of founders making the decisions going forward, but we are evolving to open that and create more of a integrated type of membership with a steering committee and general membership. So we'll be talking about that today as well. If you're interested in becoming a member of CHAMC or supporting this work in another way, also please join us for lunch and hear more about what that will look like. Thank you.
Great. Okay, well, folks, thank you, and thanks for the flexing as we were dealing with the tech stuff. Are we all set? Everything good? All good. Okay, terrific. And look, the panel is here. This is fantastic. Now, I only get to introduce 1/3 of the people who are up here, and then Patricia will introduce the rest. We're moving into the first of a couple of really important substantive panels. So when we settled on this panel, it was with the idea of helping the world to talk about some of the issues that we see happening in the US and in the European landscape, particularly the donor landscape. So we really were intentional about trying to pick people who could speak from different perspectives about that. So moderating the conversation today is going to be Patricia Kisare, who is Program Director for International Policy Advocacy with the Evangelical Lutheran Church in America. Also is an incoming board member of CCIH and is connected with Friends of Sharati Hospital, who some of you in this room will know. I was waiting for Dan. So yeah, there, you guys can have lunch together. So Patricia, over to you, and I know you're going to introduce the others. Thanks.
Thank you so much, Doug. And it's been such a rich morning already. I feel like I'm so filled, and I can't wait to receive more of all we'll be learning together. So I'm very excited and feel very privileged to moderate this panel. We have two speakers who are thought leaders with extensive experience in the public sector and in global health in general. So I, for one, am very excited. How are you feeling? Good? Are you ready? Great. So, I will just say a little bit about their bios. Please know that this is a very short, truncated bios. They do a lot more things. So they will answer a few questions pertaining to the topic that has been introduced, which is how to respond to the current political moment in our work. Our two speakers' first names are both Mark. So I apologize in advance for the confusion that may happen, but I'll try to do my best to make a distinction. So to my left is Ambassador Mark Lagon. Oh, good, we have the bios up there. So he is the Chief Policy Officer at Friends of the Global Fight Against AIDS, TB, and Malaria. He's a global health and human rights leader and has served a lot of roles, including Ambassador at Large to Combat Trafficking, President of Freedom House, which is a think tank here in the US, and has also been a CEO at Polaris. Mark has held various roles at Georgetown University, Council of Foreign Relations, and the Trinity Forum. He's an Episcopalian. I used to work for the Episcopalians, so I'm very fond of Episcopalians as well. He's interested in faith-based actors' role in public policy and human rights. I will refer to him as Ambassador Mark, so that will help me identify the different Marks we're talking about here. So, you got it? Okay. Our next speaker is Mark Chataway, who is currently serving as the Managing Partner for Global Health at Fin Partners, leading projects in Europe, the Middle East, and in Africa. He has advised Gates Foundation, Gavi, the Vaccine Alliance, and others on vaccines, HIV, and health policy. He's a former journalist and senior roles at PP and Publicis, and co-founded Hydros. He's a Quaker. I'm Mennonite myself, so, he works in multiple languages and is active in addressing health misinformation and development initiatives. He has been collaborating with CCIH for more than 10 years. Please welcome to our speakers. Okay, so we have about 25 minutes, and our conversation will be framed around questions that they will respond to. I will start with Ambassador Mark. The question is, how are current political shifts in the US, Europe, and elsewhere affecting global health funding and policies?
Thank you, and it's a pleasure to be with you all. Just wanted to let you know that the organization I'm with, Friends of the Global Fight, is a lead advocacy organization for the Global Fund to fight AIDS, TB, and malaria, and treasures our coalition relationships with those in the US we advocate with, but also those around the world and civil society and the faith-based community. In the United States, there are many reasons for what you have felt and faced of the work stoppage, the interruption of funding, and threats or possibilities of reduced funding over time. There are real budgetary concerns among politicians in the US political system, so whatever matters of ideology, there is concern about budget deficits that has been a driver. The compassionate conservative center of gravity in the Republican Party has disappeared. It has simply because of some people having retired from politics, but also a new ethic among younger politicians or the returned Trump administration. And that has also involved shifts in position of particular people. For instance, Secretary of State Rubio, as a senator, was very well known for support for global health programs, very generous, feeling that it is important for the United States to do this in and of itself, but also as a symbol of what the United States is, as others in the world, like China, are very prominent. It's important to understand that progressive Democrats in the US political system have also changed. There is a generation of great champions of global health, in particular HIV/AIDS work, who have left the scene, such as Barbara Lee of Oakland, a champion of PEPFAR, just retired. A few years ago, Nita Lowey of New York was a very important appropriator. She retired, and she's just recently passed. And Nancy Pelosi remains in the House, but is no longer the leader of the Democrats, although she's active behind the scenes. So it is not to be assumed that progressive Democrats will necessarily prioritize global health in ways that they have so ardently for 20 years. I want to thank about 12 of you here who will be joining Friends of the Global Fight and the J.C. Flowers Foundation for some meetings with the executive branch and for meetings on Thursday on Capitol Hill. There could be no more valuable voice in this context. There's an effect on other donors. In some ways, if the United States reduces its leadership on funding, it is an excuse to some other donors to also reduce. Naturally, one would hope that they would fill a void if the United States cuts back, but I'd just say from the Global Fund context of having a replenishment that happens every 3 years, by cruel irony being this year, that in some ways the United States, if it shrinks back, and I'm not going to assume it does, that it will not, that those other advanced industrial country donors may not fill the void, but may follow suit. There are those who are willing to fill the void, and those are very much on the minds of some people in the U.S. political system, Russia and China.
Thank you, Ambassador Mark. Back to my right, Mark Chataway. Should I say Mark C? Okay.
just that,
The same question.
unless you're called Mark, you're not worth hearing from. I mean, that's kind of that's the takeaway message. The rest is detail. So I was asked to speak a bit about Europe, which is clearly complicated, much more complicated than the US, because even within the European Union, we have 27 national governments making their own decisions about development assistance and often going in different directions. As Dr. Bharti said, many of these countries have cut development assistance before the US did. So the UK, for example, has had a particularly inglorious history over the last few years of going from 0.7% of GDP to 0.5, now 0.3%. And that 0.3% is actually mostly spent in the UK on hotels for people seeking international protection. So UK assistance has had a dramatic decline. But we've seen that across Northern Europe. And so traditionally in Europe, the Northern Europeans have been the massive donors for development assistance, both multilateral and bilateral. And we've seen nearly all of them reducing. The Scandinavians pretty rapidly. With some refocusing that we should probably talk about. The Dutch have taken a much more considered approach and said, we'll give you warning. So the Dutch have said over the next 3 years they will reduce their development assistance, but they haven't done it falling off a precipice. That they've given warning that this is what they're going to do. And the Dutch government collapsed last week, so we'll see what happens after the elections, and that may change. Germany has also cut its development assistance, but interestingly, has, a bit like the United States, taken the view that it can be more efficient and still deliver many of the same results. And as Doug said yesterday, I don't think any of us thought that development assistance was perfect the way it was 3 years ago. So if you look at German development assistance, about a third of it went to an organization called GIZ. I'm sure, how many people in this room have had GIZ money? Yeah, lots of people. Yeah. And GIZ was a pretty opaque, or is a pretty opaque organization. It's a non-governmental organization, so what it discloses is what it chooses to disclose. Ask how much money, GIZ money, stays in Germany, and the answer is we don't feel like telling you. So the Germans, I think the new German government has a point, and again has said that it's going to prioritize working through faith-based organizations. So Brot für die Welt is the Protestant organization, the Caritas affiliate, the large Catholic organization, and the new German government, which is a Christian democratic government in coalition with the socialists, has said it will prioritize working through faith-based groups. What we've also seen, though, is France and Germany particularly wanting to move together to counter Chinese influence in Africa. And so they might not put it quite so bluntly, but I see a few heads nodding, and that's clearly what they're doing. So they're trying to use their development assistance in a way that will build what they've called a health bubble between Africa and Europe. And their idea is they want to build up African research and manufacturing capacity, something that many African governments want to do. And they want that then to become a kind of health bubble that in a future pandemic means we would act together. And that's sort of admirable. I mean, I think it's been a bit naive, to be honest, believing they can do it in 5 years. So they had, they had the IMF set aside billions of dollars to fund African manufacturing, which can't be spent because there's nowhere that it can be invested. We've seen a couple of European countries, 3 European countries particularly, increase their development assistance. So Spain is increasing its development assistance under a socialist government and has said that its foreign policy is a feminist foreign policy. So it's taking a very distinctive course, something Sweden is also doing, and saying it's going to try to fill gaps that it perceives have been left by the UK and the US. And so particularly focusing on the rights of women, on violence, on gender-based violence, on women's education. Italy has increased its development assistance under the furthest right government in Europe, which is quite interesting and something we should all remember. So the Italian government is led by a party which traces its roots back in history to Mussolini and the fascist parties of the 40s. But it is increasing its development assistance, and it's doing that on the basis that if it can improve conditions in Africa, it will reduce immigration pressure in Italy. That may make us a little uncomfortable, but we should bear in mind that's a motivator. And then Ireland, where I live, we are increasing our development assistance, and that's just because we're good people. I'm allowed to say that because I'm an immigrant to Ireland, you see. Final point, and I'll shut up. I think the really positive signs are the involvement of the multilateral development banks in health. Now, this is pretty new, and I see Maureen nodding. This is pretty new. But we've seen the African Development Bank set aside almost $3 billion to invest in health, including primary health care. They're working with the Islamic Development Bank and with other multilateral donors, the European Bank for Reconstruction and Development. What they want, though, is very different to what ODA wants. What they want are big programs that can justify their transaction costs. So they're not interested in a pilot in one county in Kenya. They want you to come forward and say, here's a $10 million program. Better still, here's a $50 million program. Here are people who will share the risks with us, be it the private sector or there we are. Yes, I think they're listening in. Be it the private sector, be it a charitable foundation that's willing to underwrite the risks, and then they want to pay by success. So there's a big opportunity here to think of bold programs. Tanzania, I know, I'm looking at the Tanzanians in the room, has just received $100 million to build cardiovascular care facilities from that African Development Bank fund. So there are big opportunities around that and around public-private partnerships that they want to invest. I've taken too long.
That was wonderful. Thank you. Just to follow up, and I'll ask this of both of you. So given all that you have shared, what are the implications for the faith-based organizations represented here today and others who are not here? Just kind of trying to figure out how to navigate that space. Yeah, I'll start with you and then we'll move to you, to Mark.
I think the faith-based organizations are in a uniquely strong position because what I've seen of faith-based organizations and my collaboration is there's a level of flexibility and a level of willingness to try new things, which is really difficult for governments to do. Within a government, you have all kinds of legislative constraints that slow you down and make it difficult. Look at, is there anybody from the Cameroon Baptist Convention here? But not the Baptist Convention. So if there's any Cameroonian who wants to correct me, jump in. But when you move around a Cameroon Baptist Convention, remember the Baptists are a tiny minority in Cameroon. When you move around a Baptist Convention facility in Cameroon, you can't move for posters that say, have you protected your daughter against cancer? And so when the Cameroon Baptist Convention introduced HPV immunization in Cameroon, accepted wisdom by all of us working in development was, culturally it's going to be very difficult. There'll be lots of resistance. People won't like the idea of HPV. In fact, the Cameroon Baptist Convention showed in 2 years that they could get remarkable uptake with almost no pushback. There are virtually no parents who said, no, I don't want to protect my daughter against cancer. At which point the government of Cameroon went, yeah, this is working pretty well. Maybe we'll ask Gavi for HPV funding. So I think, to me, that's the model. And I think these kind of public-private partnerships, which I know MEDS and others in Kenya have done, and many of you in this room have done, are things that are uniquely possible for faith-based groups.
Thanks for asking. I may offer solidarity and hopefully a bit of hope, but funding from the United States will contract. I have to say, I don't believe that the U.S. Agency for International Development will be reconstituted. And I don't think in the short term that the United States will give much funding, if any, to the World Health Organization. But in the area of foreign assistance, for the impact on the organizations and houses of worship that you're affiliated with, global health is the single area in U.S. foreign assistance with the greatest chance to be sustained. It's not only traditionally 25% of the rather limited ODA, official development assistance of the United States, but it is politically the one area, PEPFAR, the Global Fund, other global health, it has the best chance among foreign aid areas. And faith-based organizations sharing information of the impact of your programs when they're well invested in and the effects of cuts are the most valid voice to be used. I don't think things will be as bad as they have proven to be in the last 5 months. But rebuilding things that have not been possible to sustain over the last 5 months will be very difficult, and we recognize it. And there will be some more surprises in the U.S. political system. Just know that those of us who work with secular NGOs and with faith-based organizations in the United States are there for you. Sisters and brothers, we're there for you. I'm a believer who's with a secular organization, and I regularly work with faith-based partners in the United States to advocate, but to discern not just the situation today here with you. Please know that we stand with you.
Thank you. So my next question, and I'll start with you, Ambassador Mark. In the context of rising populism, shifting ideologies, how can faith-based organizations continue to advocate for equity and access in global health without compromising their moral and spiritual identity? So that's one part of the question. I will also have a second part of the question, which is what strategies have proven effective in maintaining influence across diverse political systems?
My views are subjective, so you take or leave my advice, but I'll speak mainly to the U.S. situation. Arguing for equity and access to health care for everyone, including marginalized people, will be most effective with Democrats, with progressives in the United States and frankly in other donor countries. That doesn't mean you should shrink from the argument. You should marshal it, particularly with those progressive voices. I believe the most important thing to convey in the U.S. political context is that there was a path to transition from aid, and there remains a path to transition from aid, and that it is incumbent on all of us, including you, to make it plausible so that it does not sound to those, particularly right of center in the political system, like they're hearing a promise that they have heard for many years that transition will come. Transition will come. Showing that you are part of pressing your own governments to take the responsibility for funding. It's not a choice of either or in terms of aid, but that's a very important thing to show. And in some we're working with this week, and at Friends among you are devoted to that. The message of a transition cannot happen overnight, and that in fact a quick cut of assistance makes it harder and impossible is really important. Emphasizing that governments in your countries have a tendency to focus on majority populations and in cities, and that those who are remote, destitute, marginalized, scorned, that ends up being your job, and they'll be left behind, and the success of health programs will be harmed. I just want to say that Friends of the Global Fight is putting out a report tomorrow about sustainability of HIV programs. What is the path to epidemic control of HIV? What is the path to actual sustainable transition to domestic governments having more programmatic and funding responsibility? And that a rapid cut is almost ensures that transition doesn't work. And it will emphasize the importance of prevention, such as long-acting PrEP for HIV. I think showing how a rapid withdrawal makes stabilization and economic growth harder is an important part of the message. In terms of effective messaging, it may be hard for faith-based voices, but making clear that there is a U.S. interest in sustaining work on global health for security reasons, for the ability of economies to grow, and therefore for revenue and domestic resource mobilization. And Democrats in the U.S. political system need to hear this as well. It may be awkward for voices that naturally focus on moral arguments, and you are doing it individually, and your organizations and houses of worship are doing it because you are called to do it. But that, I think, is important. I've already given you a clue. I think that if you have 2 minutes or 1 page or whatever that will be received by an American decision maker, I'm not sure AID and WHO are the ones to spend 100% of your time on. But what needs to be most heard is reliability. We had a visitor from Ghana recently, Austin Obafuna. He's a Nigerian. He leads an NGO in Ghana, and he's vice chair of the Stop TB Partnership. Austin said in many meetings with Congress just a few weeks ago, the U.S. was seen as the most reliable partner on global health in Africa, and now it is not. And the implication is that the most reliable partner will be someone else, which is to say China. That was a very, very resonant theme. I welcome you using it as well.
Thank you for that. Just to tie a point before I turn to you, thinking about the diversity of faith-based organizations, both in the US and around the world, of course, how can FBOs really build alliances across sectors or across faith traditions to increase their political voice without being partisan?
Right. Or compromising their principles. Well, I'm happy to say a little more about this, but briefly, if you think about allies in coalition, within faith circles, if, for instance, as Christians with other Christians, staying away from the most sensitive issues that you may be divided over, or that our U.S. political system may be divided over. LGBT persons, abortion would probably be wise. Recently, I hosted with the 2 most recent ambassadors to combat human trafficking in the first Trump and Biden administrations, as I had been the ambassador in the Bush administration. We met with the NGO leaders, about 25 of them in the U.S., and I said, of all times, this is not one to highlight the divisions within. Interfaith, I think would be, interfaith efforts would be important with the progressive side of the U.S. political spectrum. I'm not sure if they're as helpful in other quarters. I would really emphasize working with the private sector, aligning with the private sector. I really want to commend the J.C. Flowers Foundation and their partners in the Isabel Flowers work on malaria, because aligning faith-based with private sector partners is an incredibly potent way to get across messages. And you must work with secular NGOs, but just to be aware, I mean, in your own political systems, they are much more likely to be seen by governments as carping critics than partners, and that's an advantage you have with your own governments.
Thank you. We only have, I think, 1 minute, Marxie, so I will turn it over to you to close us out. In the political moment that we're in right now, what are storytelling and lived faith and community level engagement play in maintaining influence from your experience?
So many of you, I'm sure, read through the Bible in a year, and in the one I'm doing this year, which is an Anglican one, you'll be glad to hear, we're at Nehemiah. And you remember Nehemiah persuades the king of Persia, Artaxerxes, I think, to let him go back to Jerusalem and rebuild the walls. And so he gets all his friends together and they rebuild the walls. And immediately everybody says, well, they're not as big as the ones that came before. And I'm reading it in the Message translation, which is modern English. If a fox gets up on the wall, it's going to fall down. And they say to him, and you just had your friends do it. You didn't have people do it who know what they're doing. What do you think? And I sort of think we're a bit like Nehemiah, right? That whatever we do, people are going to say, well, you haven't had 15 PhDs write a thesis on it. You haven't had, but we have to do things that work in the community. And what Nehemiah did, of course, rebuilt Jerusalem and set the scene for what would change all of history. So I think we have to do what works in the community. I think, therefore, that issue about speaking truth to power locally, being true to our own traditions, our own priorities. We know the questions we will be asked about our lives, right? And the questions we'll be asked about our lives have nothing to do with theology, have nothing to do with the divisions between us. They have to do with how did we treat the poor? How did we treat those in hospital? How did we treat those in prison? How did we treat those who were hungry? So if those are the questions which we address with political leaders, I think we're being true to the mandate that we've been given by Jesus, by faith. And I think we're going to get them to focus on what's really important. So I think we have to do that. And I agree with you, Mark, that we have to do it in partnership. So I was talking to the COO of Islamic Relief yesterday. He said, we've got this program in Lesotho. So I said to him, I didn't know there was a big Muslim community in Lesotho. He said, there aren't any Muslims in Lesotho. That's not the point. And I realized I had asked the wrong question. So I think all of us of faith, without compromising what we believe, do have to work together and have to work together to speak to political leaders about the things that matter to us as faith communities.
Thank you. What a good way to close this part of the session. So we want to open up for questions from the audience. Yes, so we welcome your questions. We have about 15 minutes top, and there was a lot that was said here, so maybe we'll take a couple of questions at a time, but if you have any not burning questions, please raise your hand, and then the microphones will be passed to you. I know you have questions.
Or disagreements.
To Mark, who is not the ambassador. Just mine is very small. You talked about the increased investment in foreign or in development assistance from Spain, Italy, and Ireland. At least you expounded a bit on Spain and Italy, but when it came to your country where you're staying, you did not say what it is focused on. Can you please elaborate?
One more. Yes.
Thank you very much. It's been a very nice panel. I wonder, we know USAID's successes, maybe better known to many of the folks here, have been its failures, the lack of some of its sustainability, the purchasing for some of the technical measures, and not seeing a long-term growth after USAID funding leaves. Mark, I'm particularly optimistic about the role of the African Development Bank and some of how our LMIC siblings are stepping into central leadership. What advice do you have to us, particularly to the church, to do no harm, as now we come alongside as opposed to being in leadership in the funding space as a way to double down on our commitment to non-colonialism, to non-oppression, and to being a good partner in this work? Thank you.
Why don't you? One more? Okay.
Mine is very aligned with the previous question, thinking about what are those additional optional funding sources we can be thinking about as Christian organizations, the church being one, but what are some of the others you are seeing?
Thank you for the question.
So, Ireland, we're a small country, right? 6 million people. I mean, now a very rich country, which is a big shock to Irish people. No, it is. And Ireland has gone from being one of the poorest countries in Europe to being the second richest country in Europe in a generation. I think that tells you a bit about what. So we're committed to getting to 0.7% of GDP, the UN recommended amount, by 2027. I think Ireland will be focused on stuff that is part of Ireland's history. So Ireland is historically a country which has lost people to emigration, is now getting people through immigration. But we're a country which is very a big believer in people having the freedom to move and to grow and to contribute. I think the second thing is, deep in the Irish psyche, our population is still lower than it was in 1850. And that's because of the Great Hunger. That's because of the famine, which was caused largely immediately by a potato pest and by British policy in the 1850s. And so I think Ireland will always be focused on, one of the things that the Irish remember is that in the 1850s, Native Americans, Choctaw Indians, I think, sent food to Ireland to help the starving Irish. Was it the Choctaw? I think it was the Choctaw. Yeah. And so to this day, people say, well, the Native Americans helped us. How can we then ignore people who, in a time of difficulty and oppression for them, helped us? We have to help those who are oppressed and in difficulty. So I think that will be the guiding principles of Irish policy. It's all very grand. Whether it all works out as well as it should is another question, but those will be the guiding principles of Irish policy. And then the second question was on how to work with the development banks. You said do no harm. There's a book called Quaker Faith and Practice, and one of the principles in Quaker Faith and Practice is to live boldly. And I would say live boldly. It's a bit like the story of the ruler who leaves the servants in charge of the money, right? And comes back and says, well, you buried the money. What do you mean you buried it? Why didn't you go out and invest it? And I think, therefore, we are supposed to go out and try new things and experiment and be fairly gentle with ourselves when they go wrong. So I think I would say exactly what Mark said: public-private partnerships, look for partners, looked to put together a coalition with government, with the private sector, where you can go and bid for money. The African Development Bank is led by a visionary Christian who believes that his faith requires him to prioritize health and nutrition within the work of the African Development Bank. So, it won't be easy. Banks are never easy, but I think the door is wide open, and it's a question of putting together these brave partnerships. Does that help? It's a vague answer, but.
Quickly, 3 points. One, with regard to what you said about Ireland and the thanks, the residual thanks for those who help. I just say as a theme, you as far as official development assistance goes, thank you is the very first line, of course, of any intervention with the U.S. political system. But the emphasis should be that this is not altruism. This is mainly important because we must work to, as Christians like I do, refer to the least of these, the most marginalized, but that there's some benefit. Two other points about other donors. Mark C. pointed out how the international financial institutions like big projects at scale, not pilot projects. I think it's important in thinking about private sector partnerships and private investment to also think what they're looking for. Because many times private sector partners are willing to do something with social good, but there has to be a path for the investment to pay off. And we need to help them see that path exists, because the private investment in global health programs has been limited. Private sector as partners and essential players has been important. Last point, the World Bank and the international financial institutions are very oriented towards governments, national governments, and it's incumbent on us and civil society and the faith community to press them as they come into global health to be more focused on civil society and other partners. Even private sector partners are not the focus of the World Bank. National governments are. And approximate case, the Biden administration with Indonesia, Italy, Norway, and others pushed for a pandemic fund to sit at the World Bank. It took a struggle, to the credit of the Biden administration fighting for it, to get 2 seats on the board of the pandemic fund sitting at the World Bank for NGOs. And one of them is preserved for NGOs of the global north. So that pressure is necessary on international financial institutions.
Thank you. So if we can address the last question, both of you have a chance to, which was about where can we get additional resources, funding resources from the lady over there.
So
crystal balls.
Well, just to pick up on Mark's point, I think it answers your question. Remember the demographic transition that's happening in the world. We are in a time of extraordinary demographic transition. So the birth rate in Europe is way below replacement level. Italy, 1.2 children per couple. Remember, you need 2.1 children per couple to maintain the population. So by 2090, 1 in 2 children in the world will be Africans. If you're looking at the private sector and you're a family-run company, you're not a company that's dependent on what did I do with my earnings this quarter, but you're the Roche of the world, you're German Merck, companies which are largely still owned by the families. You're thinking, where will my market be in 40 years' time? Where will my star workers come from in 40 years' time? Where will the center of growth in the world be? And the answer is Africa. The answer is to a lesser extent South Asia, but the answer is Africa. And South Asia, you have that dynamic in response to Korea and China. The population of the Republic of Korea will halve by 2100. The population of China will more than halve by 2100. So the Asian population dynamics are as dramatic, although they have a different thing. So I think there are sort of long-term investment funds who see where the growth in the world lies, and there's a potential there, provided we remain true to what we want to achieve, to work with them on resources and long-term growth.
I already spoke to the private sector and international financial institutions just with advice, not cautions to run away from them, but how to approach them and insist as faith voices on them seeing their enlightened self-interest. I don't want to overstate this, but there is a tier of potential donors for official development assistance that are really worth looking at. I find myself mentored by Christoph Ben, a left of center Christian who's at the Joop Long Institute, he's based in Geneva, but it's based in the Netherlands. There is a tier of rising potential donors. Czech Republic, Korea has immense resources and is looking to have a footprint that's larger and not only in East Asia. And so official development assistance isn't dead, and there may be a tier of countries to look at emerging. Look up the work of Christoph Ben.
Any last burning question? Okay, I saw your hand. The lady over here.
Hi, good morning, everyone. I just want to make a follow-up on the last presentation and the question made by the other lady there. We realize that all countries, when they get funding, as mentioned by Mark, who's not the ambassador, is through the bilateral and multilateral systems, which are government-oriented. And then also now that the foreign aid is dwindling, we're now looking elsewhere in other countries, but also there's this foreign trade issue, which also is impacting on whatever we're going to do in terms of investing or getting commodities like drugs, supplies, and things like that. So we are looking externally even to partner with the private sector. But my question is, with all this, we're a faith-based organization. I just want to get a sense of what is the church doing. We know that the church has money somewhere, but we are not looking for faith foundations to rescue the situation. Because even when you look domestically in terms of governments financing faith sector, the chances are limited. We might not get enough. Or maybe some of them, some countries might not even be financed through their government. Because if you look at the Abuja declaration of meeting the 50%, most of the countries are in the 6%, way below 10%. So it's worrying that we are not looking at ourselves. And I just want to find out if there are opportunities, or do we know some angles where we can get into the faith sector to finance its own health sector? Because we are there for them. They put us there, but they're not giving us any cent. Thank you.
Thank you. Anyone wants to start? Respond? I apologize, we're really behind on time, and they're giving me directions here. I'm sorry, maybe after the fact, you can find the speaker somewhere and ask a question. Thank you, I apologize.
A quick moment. There's a leader in the world born in the United States who is extraordinarily important, and his name is not Donald Trump, is the Pope, and that's one place to look. I just want to say, while I still have a moment, please realize that PEPFAR and the Global Fund remain important vehicles for assistance, and they're the ones with the most likelihood of being supported by the United States. And I know many of you are concerned about vertical programs, overly siloed programs. But just as PEPFAR has been nested in a bureau on health security and diplomacy and is acquiring new responsibilities that used to be at AID, we need to figure out how to make the vertical and the horizontal work together. And there are ways that the PEPFAR and the Global Fund can continue to be used for the broader programs, even more than they have in the past.
One of my colleagues used to be the finance minister of Zimbabwe right around the turn of the century. And he's a PhD in biochemistry. And he said to me one day, I love talking to scientists. He said, it's my background. But he said, as Minister of Finance, if the Catholic bishops came in to talk to me, I sat up and took notice, because the scientists couldn't get me fired, but the Catholic bishops could. And I think there's a real lesson in that. So, I come from a continent which is increasingly secular, right? We have pretty low rates of church attendance. We have a bit of a revival going on, young people coming back to church across Western Europe. But we're not yet at the point where we are a decisive political force. But in much of the developing world, faith leaders are the decisive political force. And so it's a question of, I think you making that case you just made so eloquently, you have to focus on spending on health. You have to focus on spending on the sick and on the poor and on the marginalized. And that's what we're called to do. That's our prophetic role in countries.
Thank you for your attention, and thank you to our two tremendous speakers here. I'm sorry we kind of ran out of time, but how about a round of applause for all of us? And like I said earlier, I think we might be around, so if you have any other questions, please find our two speakers, whatever they might be.